Grace and Noble.
So guys, today we'll be talking about progressive lenses. What are progressive lenses? Before we talk about why the name has been given to progressive lenses, let's go back into history. The concept of progressive additional lens, in short PALS, has been around since the beginning of 19th century, 1907 in fact, when the first patent of progressive lens was published by a company called Owen Avenue. Progressive addition lenses are called by its name because they are one-piece lenses that vary gradually in surface curvature from a minimum value on the upper distance of what a patient sees to a maximum value in the lower near portion. Do you understand what I'm saying? Normally, a patient looks at distance as well as at near, right? They read something. So, progressive lenses increase in power from distance to the near. So the addition gets more and more. The plus power gets more and more. That's why they progress in the lens power. In short, they are also called no-line bifocals because in bifocals you will see lines on the lenses. In progressive lenses, it is like a spherical lens. Unlike bifocal or trifocal, progressive lenses ensure presbyopic spectacle wearer finds the right dioptric power for every distance, guaranteeing smooth, uninterrupted vision without any visible lines of demarcation. Again, to elaborate that one, when a patient has presbyopic power, when they have reading power, when they wear a reading power, the lens ensures that wherever they look through the lens, they get the right dioptric power, lens power inside the lens. That's the technology that is being used in a progressive lens. Whereas in bifocals or trifocals, Cryptalk, E-line, executive lenses, all this, the distance power will be different, the near power will be different, and there will be line of demarcation. In progressive lenses, you don't find the line of demarcation. Again, as I told you, the power progresses. The increase is achieved by constantly decreasing the radius or the radii of the curvature in the vertical and horizontal meridians of the lens. This is the technology behind. So as you can see it in the picture, how the curvatures, vary, the front curve and the back curve, and how the difference in the power increases in a progressive lens. Now talking about distance power. Designated zones located in the upper portion of a progressive lens which provides the necessary distance correction. As you see, any patient, who needs a minus or plus power for the distance, all right, that will be found on the upper portion of the progressive lens. Whereas near power, there is a designated zone in the lower portion of the lens which provides the necessary near addition or the near power. So, which is always, as you can see from the prescription, addition plus 1, addition plus 2, addition plus 3. That will be the power that will be on the lower portion of the progressive lens at the bottom. And then the best part of a progressive lens is the intermediate zone. A corridor in the central portion of the lens connects those two zones. There is a distance zone, there is a near zone, and those two zones are being connected by a corridor, which is called the intermediate zone, which increases the progressively in power plus power from the distance to near. This is the zone which is called as the progressive zone. Okay, I will explain to you much in detail when we are on the Zoom call. So what are the advantages of a progressive addition lens? Most importantly, it's a no visible segment lens. You will not find lines of demarcation on the lenses to show to other people who look at you that you are wearing some kind of a lens. In most cases, the cryptox and the bifocals people wear, and immediately they are noticeable, and that reflects their age. This is not what people will be seeing when you wear a progressive lens. So, meaning to say, no line of demarcation provides more cosmetically appealing lenses with continuous vision, free from visually distracting borders. All right. So if you are going to wear a progressive lens, if there is a line of demarcation, there will be a image jump. The lens looks like a single vision lens as a result. So no line progressive lens, comfortable intermediate vision, continuous support to the eyes on accommodation. These are the advantages and benefits of a progressive lens. Then we talk about the design. You will be finding different types of designs in progressive lenses. So when a company introduces a lens to you, you just need to understand what kind of a design you are having it. Don't go much in detail, but I will give you something very generic for you to understand. When we talk about progressive lenses design, there is a mono design and a multi design. What's a mono design? Mono design progressive lens is a single design used for all addition powers. The position for the near vision does not change with the change in addition power, causing difficulties while viewing near objects as the wearer holds reading material closer to him with the increase in the near addition power. What does it mean? So the addition power is fixed in a mono design. So you have to adjust the position of the reading book rather than automatically adjusting to wherever the reading book is in accordance with the power that has been put in the lens. Whereas in multi-design, the position for the near vision changes with the addition power change. That is, the near area goes up with the increase in the addition power. So the more you tilt your head and look at the book, the near addition goes up. That's how but these are very old designs. I don't, if where in the world these kind of designs are available, but that's how it used to be, mono design and multi design. Then we talk about the symmetry and the asymmetry design. In asymmetry and symmetry design, in case of symmetrical progression power lens design, the right and the left lenses are identical. Right eye and the left eye lenses are identical. Asymmetric progressive addition lens design incorporates the nasal offset of the near zone and has a separate design for the right and the left lens. Again, these are old technologies, not to worry much about it. Now there is something called the hard design on the soft design. You will find it very common in the markets. A hard progressive addition lens design concentrates on the astigmatic error into smaller areas of the lens surface. What happens because of the curvature of the lens, because of the technology that is used in terms of hard lenses, there might be induced astigmatic error in the lenses. Don't bother about too much about it. Just understand that because of the technology, there will be induced astigmatic power which will cause discomfort to the patient. A hard progressive addition lens design concentrate on the astigmatic error in the smaller areas of the lens surface. thereby expanding the area's perfectly clear vision at the expense of higher levels of blur and distortion. Okay, so focus is on the smaller astigmatic areas, whereas there will be a compromise on the higher levels of blur and distortion on the wider area. This is how a hard design is all about. In hard design, wider distance zones, wider near zones, more narrow and shorter progressive corridors. The corridors, as I told you, the progressive corridors are shorter and more rapidly increasing levels of astigmatic error. Soft design, a softer progressive addition design spreads the astigmatic error across larger areas of surface, thereby reducing overall magnitude of blur at the expense of the narrow zones of perfectly clear vision. So if there is an astigmatic error, soft designs, what they do, because of the discomfort that is caused and that will be causing headache, so they try to minimize the effect of the astigmatic error in soft design lens, but there will be some kind of compromise on the narrowing zones of in the progressive zones. So in soft designs, the narrower distance zones, then narrower near zones. So I mean, when you look at the progressive lens, have a look at the progressive lens and look at the definition of it. In a progressive lens, you will have progressive zones. So these the corridors, these will be narrow distance zones and narrow near zones, longer and wider progressive corridors. So in soft design, the corridors are longer and wider, more slowly increasing the levels of astigmatism. That's simple. So in hard design and in soft design, the longer and wider progressive corridors. In hard design, the progressive corridors are shorter. Understand this. That's it. Okay, don't delve too much into it. The optometrist will take care of it. Then we talk about the lens itself, the markings on the lens. What supposed to be very important when you take a lens, when you see, as you can see it on the slide, A, B, C, D, whatever that is being marked, just remember it. That is so important when you have a look at it, especially the fitting angle, the fitting cross. Let us talk about what is A and A1. A and A1, they are two hidden circles which are permanently etched on the lens at 35 millimeter apart. A and A1. There are two small hidden circles. When you fog the lens, blow on the lens, fog it, and you will be able to see some kind of circles on this. These are called small circles. You will see. And then you will see point B. This is called the optical center, distance optical center of the lens, and is known as prism reference point. Point B is prism reference point. In other words, it's called distance optical center of the eye. Okay. Then comes point C. Hidden addition situated at the temporal side. What is temporal side? Opposite of the nasal side, opposite of the nose. The side near the nose is called the nasal side. The side opposite to the nose is called the temporal side, and is made visible by fogging. What has the addition power of the progressive lens? If you have, for example, +2, and you need a progressive lens, right? So this addition is etched on the lens. When you fog it, you will come to see it has been done. And then there is point D, 0 to 180 degree axis line passing through the optical center. This is very visible. In most of the lenses, they will be just visible distant, the optical line. This is, on the horizontally it will be marked. with like hyphens. And then it is E is again very visible. It's called the fitting cross just above the distance optical center. It's called point E. And then you will have distance power circle to check the exact distance power with the help of a lensometer on the right on the top of the point F. Then you have G, hidden logo of the company, situated nasally and is made visible by fogging when the ink marking is removed. In HLR you have so many brands, right? Liberty, Comfort and everything. In each and every brand has a logo. So when you fog it, you will see if there is a Comfort, there is a different logo, and if it's a Liberty, it's a different logo. Then you will have H. 70 mm to 90 mm circle is the center of the near vision area and is inset 2.5 mm, point H. So once you understand, have a lens in your hand and understand this is how it's being done, manufactured, and in practice, then you want to check the power of the lens distance, your power of the lens near, and then you want to see the fitting cross, you want to see. So all of these things are very important when you talk about prescribe progressive lenses to patients. Once the above adjustments are done, then most important part is the monocular PD. I have taught you how to take monocular PD and the fitting height. This is more of a technicality, especially when you measure the fitting height and the monocular distance and write it on the prescription. The optometrist does it. You don't have to do anything. But when you take a prescription in your hand, you have to understand, is there a PD in it or not? If it's not, you have to refer it back to the optometrist. And so is the fitting height. The fitting cross of the progressive must coincide. This is very, very, very important in most cases. Sometimes, if the fitting cross is not there, the optometrist will take care of it. But don't worry about it. What is more important for you is to understand that the fitting cross on the progressive addition lens must coincide with the pupil center of the wearer in their natural posture. What is natural posture? You just put on the frame and tell them, how do you wear this? Okay, this is how normally I wear it. And then the PD is taken. At that point in time, you mark where exactly the pupil is. And that pupil position should align with the fitting cross. Okay. So the following procedure is used in measure the fitting height. I have taught you before, and again just to refresh you, place yourself opposite at the same height of the wearer. Ask the wearer to adopt the comfortable position. Ask them to the wearer to look at your left eye. Hold the pen torch just below and then mark the pupil, and from there you measure the fitting height. So likewise on the right and likewise on the left. That's it. And once the fitting height is measured, the ideal position of the fitting cross should be shown, and accordingly the lenses are fitted. This is how the progressive lenses are dispensed. Again, we will take you through this in practical terms, and we will talk to each other, clear all the doubts. That's it. And then you become a wonderful progressive lenses salesperson. Clear? Have a nice day.